So one common way that families find themselves involved with genetics is via the newborn screen, sometimes referred to as baby's first test. So this particular test is done about 24 hours after a child's been born. It usually involves pricking their heel, the bottom of their foot, and taking a small blood sample, putting it on a piece of filter paper card and mailing it to a lab that is checking for some common and some not so common genetic disorders, with the overall goal of identifying children who may be in need of more immediate medical intervention to prevent those health problems from getting worse. Um, so there are many benefits to having newborn screening. So the early detection of certain genetic conditions is hugely important. The earlier that we can diagnose individuals with genetic conditions, especially those that are treatable, the better. Not every genetic condition does have a treatment, but many do. And so the goal of newborn screening is to identify as many of those children as early as possible and funnel them into the right place, hopefully before they start to have any kind of health issue. Sort of on the flip side, when we do newborn screening, because it is something that's done for every baby who's born, we do actually have a low threshold for a positive newborn screen. And so there is a reason that we do that. We want to have a low threshold to pick up as many people as possible. We don't want to miss anybody. And so in our effort to not miss anyone, we may actually scoop up some people who we don't need to see. And unfortunately, that can be a really distressing experience for some of the families who are in that basket, because we are asking the families of newborns to drop what they're doing and come see us as soon as possible. And sometimes their child doesn't have that condition. So we've sort of put families through the ringer, you know, and not found a genetic condition. So at the end, there's some relief, but in those early stages, that can be really distressing for families. But the overall goal of this public health measure is to make sure that we are taking care of babies the best that we possibly can. The newborn screen is a state-run program, so each state runs their newborn screening program independently of the others, which means that they each get to decide what conditions go on that newborn screen. Now, there are lots that are sort of across the board, but there are just as many, if not more, that are sort of variable based on the state that you live in. And that's another problem, is that if a child's born in Pennsylvania, perhaps they may be screened for something that a child born in another state may not be. That is a huge undertaking for a lot of advocacy groups to sort of push to have certain conditions added to that newborn screen. So that is an ongoing process. So even if it's not on the newborn screen now, that doesn't mean that it may not be in the future. And that is absolutely an effort that genetic counselors stand behind to help advocate for those things. Really, the purpose when we do newborn screening is to identify children who have a genetic condition for which there may be some sort of intervention. There's not really a cure for very many genetic conditions, but there are some that have at least some sort of treatment that's available. So for example, in the context of one particular condition called spinal muscular atrophy, or SMA for short, there are medications that are available, and there are several medications that are available for individuals who receive that diagnosis. So when the newborn screen comes back and we identify this, a particular condition, the most important thing is to confirm that diagnosis. So sometimes that requires some additional lab work or imaging or additional testing for us to be absolutely sure that that person is affected by that condition. Certainly, as a genetic counselor, I'm there to share that diagnosis with families, explain what that disease looks like, as much of a crystal ball as I can give people in terms of the sort of long-term effects of that condition. And if there are any treatments available, certainly we share those options with families. Um, we then involve specialists in that particular condition. So, for example, in the case of SMA, that would be neurology. They see that condition quite often, and they would be the experts in some of that treatment, along with your genetics providers. And so I do rely very heavily on those specialists to sort of outline for the families the benefits and the limitations of that treatment. Just because there is a treatment for a genetic condition does not mean that that treatment is a cure. It doesn't necessarily mean that that condition or its symptoms will go away altogether. It may just slow down the process, for example. And so it's very important for me, for the experts in that field, to be able to sit down with those families and walk through those options with them, keeping in mind what's important to that family. And so I do very much appreciate being part of that conversation because I can talk about what is important to that family and help them sort of walk down those different paths. What will this look like if we treat it? What will this look like if we don't treat it? How is this going to impact our family, our other kids, our brothers, sisters, aunts, uncles, etc. And so it's really a group effort to decide whether or not we're going to go down those certain pathways.